Hi, my name is Vanessa Ajay, and I am going to be presenting on opioid-induced constipation, and this is for ECPI University, and this is my senior practicum. So my learning objectives were to research from credible sources, which I did to acquire evidence-based insights on my topic, which is OIC, analyze the literature on OIC, and also using the evidence-based literature to develop instructions and guidelines on OIC prevention and treatment. I did an outline, I used the lesson plan to get inputs or to do my teaching, gathered inputs, and also feedbacks from my colleagues. And also I did the post-test after the teachings, after the in-service on the staff on prevention of OIC. So what is OIC? OIC is basically defined as a stomach and functional digestive disorder comprises of constipation and irritable bowel syndrome. But for the sake of my project, I did constipation, or I focused on constipation. What are some of the symptoms of constipation? Bloating, nausea, vomiting, abdominal pain, straining. Patients do experience right after surgery, and sometimes too, they do experience it gradually as they take that pain medication. I work in same-day surgery where we perform elective surgeries, colorectals, we do the EUAs, the biopsies, orthopedics, hip replacement, shoulder, the hand. We also do vascular, we do the eye, we do a lot of elective surgeries. And so we do see a lot of patients being prescribed pain medication or the opioids to take home for pain management, because patients do go home right after surgery after they meet the hospital guidelines or the unit guidelines, then they'll be able to go home. So we just, it was something that has always been on my heart, just to make sure that once they are going or leaving to go home, that they have everything that they need to help them with their management, pain management, and also with their well-being at the end of the day. So instructions on reduction of OIC. So I did my in-service. I was fortunate enough to have great nurses to be a part of this project for me on the unit. It's a very busy unit, so I was not able to get everybody together. So I got 2 groups here and there, 2 groups, and some I did one in service with them, and just instructing them about the use and the benefits of fiber supplements, laxatives, aloe vera treatments, also encouraging physical activity, fluid intake, heat or ice therapy, and also avoiding trigger foods. One thing that I love about my unit as a unit, the charge is when the patient comes to me getting ready to go home, the first thing that I do is to get them up. I just get them up, we walk around, we do a couple of lapses. Even before pain management, we walk, we drink. Pain medications is always our last resort. It's something that has always been dear to me. And, as we are prescribing this medication, most of the time, we are only managing the pain, but we're not managing everything else that this pain medication is going to come with. So I thought as much, it was very important and necessary that we are teaching our patients on the benefits of being able to move their bowels on a daily basis after surgery. So it's going to be a new lifestyle for the patients, but we have to encourage them to do so. So for the in-service, I use the lesson plan, which I presented with my laptop. So I just went through all the bullet points. I made it very, very, very entertaining, very, very, something that everybody was, very engaging. We all talked about, we shared ideas, things that were not seen as important, because, most of the unit comprises of seasoned and brand new nurses. And of course, we want to teach the brand new nurses the right things to do, not just telling patients, yes, take this, take that, but we have to explain to them the reason why. So we have to implement what we are learning here onto our patients so that they'll be, at the end of the day, we're going to have a better outcome. So with the teaching, one of the feedbacks that the seasoned nurses didn't like was they preferred that I use a brochure or a pamphlet, something that they can print and just sit down and read versus using the computer. Because, with the newer nurses, they are younger, they are very computer savvy, and they were just, they were just fine with that. So after my presentation, I did the questions and answers. In the beginning, the seasoned nurses were struggling, but they got, they got good. I mean, they were okay at the end. So like I said, I was not too worried or too concerned about the score, but I was more so, I just wanted to make sure that the nurses understand the reason why that the patient have to take this and that, the benefits, so because we cannot teach our patients if we don't understand what we are teaching them. We have to go through the backgrounds of everything that we are teaching them. And every patient is unique, every patient is different. So we have to make sure that we have the patient history, knowing how much the patient can tolerate and patient cannot tolerate. So the dosaging is very, very important. So this whole thing that we are talking about is not just, us, the nurses. It's going to take a whole stakeholders, the physician, the pharmacist, the nurses, all of us, and the patients together. You have to come together as one and do what is best and right for that particular patient. So, I remember when we're in nursing school, we used to talk about, or we were taught to use other measures instead of, medication. So teaching our patients how to deep breathe, taking their minds off of the pain, walking around, using heat, using cold therapy, those are all vital and they help. So if they are doing all those measures, then they're not going to need a lot of medications, because most of these medications are every 4 hours or every 6 hours. And some patients, are probably going to be taking it because they are in pain. But we just encourage them to do other things so that they don't take as much medication. And then we can reduce or eradicate, if not, reduce, the occurrences of OIC. So, we just have to have an open conversation with ourselves and then our patients, the doctors. One benefit that we've had on our unit for the past month is our doctors are now prescribing medication, these two softeners at the hospital before the patient goes home. So they get a dose before they go home. So that is a plus. They are listening to us and prescribing all these medications, the stool softness, and of course they go home with their own prescriptions. And most of these measures that we are talking about, the Benefibers, the Colace, the Dulcolax, the Miralax, all those can be obtain over the counter. You don't need a prescription for it. So they can just go to their own pharmacy and just pick those up and start taking them right away. And some people have them at home. So we just want to encourage and teach our patients to use what they have at home for their own benefits. So like I said, we just have to understand that the patient's past medical history. We have to have a strategy, and that is making sure that everybody's on board so that we can help minimize the occurrences of OIC. OIC affects millions and millions of Americans each and every day, and so in each and every year. So we just have to make sure that we are teaching our families and our patients how to, minimize the occurrences of OIC, because it's not going to help. Everything that we are doing here, we're not just saying it to say it, but at the end of the day, we want it to benefit our patients, because once they're able to move their bowels, it's going to help them at the end of the day. They're going to feel better. It's going to help in their recovery. Just imagine having a hernia surgery, 4 abscess on their belly, and then, all that pain. You try to go to the bathroom, you're straining. Some patients pass out, and that is not a good thing. It's serious. Some patients also, they'll open up their incision, and that puts them at risk for infection. So it's very, very important. So it's not just telling our patients to take it, but we have to make sure that they understand it. We need to get a verbal understanding. They need to give us a verbal understanding, of what we are telling them. They have to, it's basically like a teach back. We just have to make sure that we are understanding them, and then they are understanding it, and also listening to them for their concerns and everything, so that at the end of the day, we are doing everything that we are doing here because of the benefit of our patients. Thank you.